August class, okay, your August class, we already talked about this. I just want to wait for the handout to print out. So before we start the room 2, I want to talk to people who wasn't in August class and that took OSCE prepper course last year. There's a small minor change in station 5, okay, but the major change is in station 2. So station 5, instead of having you to explain to the client initial treatment plan and ongoing treatment plan, they eliminate or they get rid of the ongoing treatment plan. So there's no more ongoing treatment plan. All you need to do is for initial treatment plan. Okay, guys, you guys can come to me after the class, ask me to point out the handout for you guys, the speech for room 5. Okay, so for room 5, you only need to explain the initial treatment plan and then to get a consent from the client. That's it. There's no ongoing treatment plan. Okay. They will, again, this is very similar. They will give you the client interview and assessment result on the stem, okay? And generally, the client will not answer any questions about health history and assessment findings. So that means in room 5, there's no conversation, okay? You don't ask any other questions other than, may I have your consent? Or do you understand? Do you have any other questions? Other than the 3 questions, they don't answer you about, like, you say, oh, you don't have high blood pressure, right? They're not going to answer you because you're not supposed to ask a question like that. Okay, so in room 5, there are only 3 questions you are allowed to ask. May I have your consent? Do you understand? Do you have any questions? That's it. There's no conversation in room 5, right? You will be expecting to design an initial treatment plan. That's it, initial treatment plan. So, considering finding provided on the stem, they're going to give you the information, communicate that plan to the client, okay? Obtain informed consent to proceed with the treatment. When necessary, candidate can also expect to obtain written consent for the inclusion of any relevant and sensitive areas. But in your case, you will have to, all the cases will involve sensitive area. That's one of the key points they're going to test you. So be prepared. Room 5 will have sensitive area. Okay. There will be, this one is the same reusable written consent form. It's laminated. Okay. You can, they're going to ask your client to sign it. There's going to be erase it afterwards. The client is fully closed and will not consent to remove any article of the clothing. Apparently, over the in the last years, their students ask the client if they can move their clothes during the initial treatment plan. And you're not going to touch the client. You're not going to ask them to remove any clothes. They're not going to answer you. Okay? Other than the written consent form, there's no other equipment provided or required. Okay? And that the written consent form I already gave it to you guys, that piece of paper. And there's 4 parts. You just check and put the client initial. That's it. You already have that. Okay. The consent must include the decision with the clients about 6 elements. So these 6 elements is a must say in your initial treatment plan. Okay. The first one is the nature of the treatment. Okay. The second one is expected benefits of the treatment. The third one is the risk and side effect for the treatment. Okay. The fourth one is alternative course of action. The 5th one is likely consequences of not having treatment. The last one is the client's right to ask questions about the information provided, and the assessment or treatment will be stopped or modified anytime at your request. So these are the things that you must say. Okay? To emphasize that, what is the nature of the treatment? What is the nature of treatment? Everything is on the speech. So just give you a little quick rundown. So thank you.
So many people.
I know, I understand. Thank you very much. Just leave it for now. Okay. So the client, okay, nature of the treatment means what? It means the client must understand exactly what the RMT is proposing to do. Okay, proposing to do. The RMT must explain what kind of touching will be involved in both assessment and treatment. So you have to mention how you're going to touch the client. Okay, I will only touch undrape area I'll be working on. Okay, or gentle touch or deep pressure, stuff like that. Okay, and the area of the body RMT proposed to touch. Which area? I'm going to work on the upper body, especially on the right shoulder. Be more specific. That's the nature of the treatment. Okay, what are you going to do today? We're going to treat your shoulder, treat your frozen shoulder, treat your upper cross syndrome. What are you going to do? And then the expected. Okay. And the second one, expected benefits, means what? Means the RMT, you must explain the rationale behind the proposing that procedure, like why you're doing this. I know you're going to work my shoulder, but why you're working on my shoulder? Okay, tell the client. Okay, how does the procedure fit with the client's treatment plan? Okay, how likely is that the benefit will happen? As in, because you have let's just say piriformis syndrome, that's why I have to work on your glutes area. Okay, there has to be a reason. Okay, by working on this area, it can help you to what? To reduce pain, increase range of motion, promote blood flow, and stuff like that. Okay. And then number 3, risk and side effect. By this, we mean the RMT must explain any risks and side effect. Okay, a risk or side effect that should be shared if a reasonable person would want to know about it. As in, okay, you may feel little dizzy or lightheaded afterwards, which is completely normal. Tell the client how to avoid that. Or there's a risk that you may feel a little burning sensation, stuff like that. Give a little detail. Let them know what they're expecting. How it's almost it's like a abnormal sensation they're feeling. They're not supposed to feeling dizzy, but they do. Why? Because they get up too fast, or they're not supposed to feeling just like burning sensation or pain. Okay, if that happen, tell client and communicate with the client, ask to stop, stuff like that. And then alternative course of action. By this we mean that if there are alternative course of action, the client will be informed of them, as in if there's any other way that you can approach or address that condition. Even if the RMT does not recommend or cannot provide the option. For example, it is too aggressive and has a higher risk. You can say let's just say we're treating the trigger point. Okay, you can do the ischemic compression, but we also have another let's just say another way to use for example, another tool to work on the trigger point. But this one is going to be very, very painful. Okay, I do not recommend it. However, I'm obligated to let you know there's actually other option. Or the RMT, the RMT cannot provide it. What it means is I recommend you to do just say spinal adjustment. That we cannot adjust the spine, but you can always go to see chiropractor. And because chiropractic is out of my scope, I can't practice this. I'm still obligated to let you know that you have other options between chiropractic and massage, right? The RMT describe the options and tell the client why they're not recommending it. Even though you don't recommend it, tell the client why. The reason, for one, I cannot provide it, or I believe this technique or this approach is has higher risk. Okay, whenever it is a reasonable option, RMT must inform the client of an alternative treatment that is offered by another healthcare provider. It means you cannot just say, oh, only massage can help you. No, you can still see, for this reason, you can still go to see acupuncturist or physiotherapist or chiropractor. You give them option, right? Number 5, likely consequences of not having the treatment. So the RMT must explain to the client what is likely to happen if the client does nothing. If it is not clear what will happen, the RMT should explain and provide some likely scenarios. For example, if you don't know what's going to happen, speaking of my experience, if you don't do anything about your condition, it might take a lot longer to heal, or it may get worse. right? Or it may not change at all if you don't do anything. Okay? You give them the scenario, speaking from experience. The last one, the client's rights to ask questions about information provided, and that assessment or treatment will be stopped or modified at any time at their request. So RMT must provide an opportunity for the client to ask questions before providing consent, and notify the client that they can stop or modify the treatment at any time. This is why in the speech, I multiply mentioned, do you understand? Do you have any questions? Once you get a positive feedback, okay, and you move on, you continue. You have to make sure during that explanation, the initial treatment plan, you ask the client multiple times, do you understand? Do you have any questions? If they do understand, yeah. If they have no questions, you can continue to move on. All right, that's the only question you can ask. May I have your consent? Do you understand? Do you have any questions? That's it. They will not, I guarantee you, they will not make a sound. They're not going to ask you any questions, but you still need to ask, do you have any questions? All right? It means you have the what? You have the obligation. You must give them opportunity to ask questions. So that's the room 5. Very minor change. No more ongoing treatment plan. So room 5. Quickly go through the speech, and afterwards you guys can ask me for the USB copy, right? So room 5, again, you need to wash your hands before you start a conversation. 7 rooms, all the rooms, walk in, wash your hands up to the elbow. You don't have to say, and let me wash my hands up to my elbow, okay? The examiners are not blind, they can see you. You don't have to describe everything you do. Okay, but you have to demonstrate that you are actually washing your hands up to the elbow. Okay? So while you're washing your hands, there's no sink, just hand sanitizer. While you're washing your hands, talk to the client. Hello, my name is blah blah. I will be your massage therapist today. Okay? Lately, personally, I wouldn't recommend you to say the word student anymore, because in that scenario, you are their therapist. I'm not saying student is wrong, just that you have to get more into that role. It's a role play, right? You have to get more into that. I'm your therapist today. Show the confidence, okay? The one thing you don't want to say, you don't want to do is you look very like just being like timid, as in you look scared. You shouldn't be looking scared. At least pretend you're confident, okay? You cannot look scared in front of your client, right? I'm going to quickly review your file. Please give me a few seconds. Thank you. You already have 2 minutes to read the file, right? After our case history interview assessment and giving my clinical impression, I would like to spend a few minutes to explain the treatment plan that I made, I designed, I tailored, or prepared for you. Choose any of the 1 words. Please don't use the 4 in a row, for God's sake. Please, okay? And your condition, as we discussed, is what? It's on the stem. Okay, condition can be changed. And I believe massage therapy is going to be beneficial for you. You don't have to take picture. You can get a handout. Okay. We will also discuss what to expect from today's treatment. Okay. You will have opportunity to ask any question that you may have. Okay. And then continue. You just start by saying today's treatment is going to be how long? 1 hour. The cost is $100. Duration and the price is up to you. You can make up any length and the price, okay? And the nature of treatment, my goal of the treatment is what? To help with this condition, okay? The treatment will reduce the pain, relax the muscle, and increase joint mobility. And your focus on the treatment will be, I will be focusing the treatment on your back, shoulder, arm, and put specific emphasis or focusing on. Word can be changed. Okay? On your neck. Again, the area can be changed based on your condition. Client have low back pain, you will be working on the lower body. Right? I'll be applying some light and deep massage techniques using my hands, forearms, my elbows. How are you going to touch them? Hands, forearms, elbow. Okay. To release taut band on your what muscle. In room 5, they usually tell you there's a taut band on what muscle. Okay, they're not going to make you think which muscle I need to work on. No. They give you specifically which muscle has what. All right. To release your taut band to release Taliban on your what muscle, I'm going to use the trigger point technique. That's it. You don't need to explain what is the trigger point or how you're going to do it. Like I'm going to press down, ask you to scale from 0 to 10. No, you don't get details into what technique you're going to do. Okay? And then to reduce adhesion on your what muscle or which area, I'll use the cross-fiber friction technique. And that's it. Okay, that's it. Like, why do you ask the extra consent? There's no such thing as extra consent. Okay, when we do cross-fiber friction or trigger point technique, there's painful or burning sensation. That's the client care part. When you actually get your hands on the client, you communicate with the client. It's too much, or you can let me stop, or I can reduce. Okay? You don't have to explain too much of the details in the treatment plan. And then say, I will use relaxation techniques to work on your tight or hypertoned which muscle. They're gonna give you the stem, says which muscle are hypertoned, which muscles are tight, either or, okay, relaxation technique. Okay. As for the restricted area, I'll be using fascia release technique. Fascia release, right, restricted. And I'm also going to use joint play to increase the range of motion of your which joint. They'll tell you which joint has limited range of motion. Okay. And also they'll mention like a weak muscle. Keep that in mind. They may not have all the conditions together. Okay, you don't repeat everything. You basic on the case they gave you. If they don't have adhesion, you don't have to say the adhesion part. Okay, you don't have to say everything. I gave you everything list here so you know there's a possibility there. It doesn't mean you have to use all of them. Okay. Because you have some weakness on the what muscle, I will use some stimulating techniques to wake up the muscle. That's it. Okay, you don't have to say I'm going to use hand movement, I'm going to use beating and. I'll also be using hydrotherapy, which is hot and cold temperatures, and also some stretches. List all the techniques you're going to use, but don't go into details. Okay. And then communication part, that for your safety, I'll be communicating with you during the whole treatment, okay, to make sure that you're feeling comfortable and my pressure is tolerable for you, or my pressure is make you feel comfortable. And during the treatment, if at any time you feel pain or discomfort, or for any reason, you can stop or modify the treatment. See, this is the client part, okay? It doesn't have to be pain, or as long as they feel uncomfortable. Sometimes maybe when you undrip the sensitive area, you can feel the client is like sort of holding in. They don't want to, they don't look comfortable when you undrip, just say, maybe when you undrip the upper chest wall. Okay, the female client shows like they really don't want you to, even though they gave you the consent, right? So this is tell the client, if you feel pain or any discomfort, okay, for any reason, you need to ask me to stop. You can ask me to stop, or you can modify the treatment, okay? After this part, ask your client, do you understand? Do you have any questions? Make sure what you just said, they fully understand. And then you move on, okay? There's an alternative course of action that if you find the treatment is too painful on your body, then we can go with more relaxation approach. Okay, I can do a full body treatment and focus on improve the overall condition. Okay, using more stretch or more stretching techniques. Okay, and then this part is more important. Okay, that if involves sensitive area, written consent is needed. But in your case, there will always be written consent. Okay? So due to this condition, piriformis, let's just say upper crowd syndrome, I need to work on your what area, which sensitive area, glutes, upper chest wall, inner thigh. This is a sensitive area. I'm going to need your signature to perform the treatment. Okay, explain why you're doing this area. Okay, I won't touch the area without your written consent. Make sure that they know only with written consent you can touch them. Okay, if you don't feel comfortable, 我还没发，一会儿再说。If you don't feel comfortable having this area worked on, I can modify the treatment plan. Okay, and this written consent is voluntary. Make sure they know this. Please sign it only if you understand what I said and agree to let me work on the mentioned area. Okay, very specific. If you agree and if you understand. Okay? And then ask your client to sign it, right? right after they sign the consent, you repeat that, please let me remind you, you may withdraw your consent at any time. The people sometimes, when it comes to write name down, they are very unsure about. Okay, verbally, there are no problem, but if you put it on the paper, sometimes they're unsure about. So you have to make sure that tell the client, you can withdraw the consent at any time. So give them the rights to change your mind. Okay. After they sign the consent, another question, do you have any questions so far? Okay. And when they say no, and then you say after the treatment is over, okay, you may feel a little dizzy, lightheaded or dizzy. This is normal. Please take your time getting off the table. Take a few deep breaths. Don't get up too fast. Okay, tell the client you may feel something, and then how to avoid that. So when you go home tonight, you may feel some soreness. Again, this is normal. Please make sure you take a warm shower and drink plenty of water to have the toxin flush out of your system or your body. Okay? And then this is a part a little different. So when I leave the room, you may undress to your comfort level. You may keep your clothing on. I can work through your clothing if you like, but working directly on your skin is going to be more beneficial for you. Explain, there's option. You can either keep your clothes on or you can take it off. But there's more benefit for you that if you take it off. Okay? And then to find your way to, tell the client, find your way to the massage table, lie down on the table, face down, please put your head into the cradle. Keep that in mind. The client you're talking to is the very first time to have massage. They know nothing about how to get on the table, what to do. Okay? So you have to be very specific, detailed. And place yourself in between the sheets and cover yourself with the top sheet. Okay? I'll be outside if you need assistance getting on the table or remove part of your clothing such as your shoes or anything. Please let me know. Okay, tell them you will be assistant. You're outside. And then I'll then knock at the door to hear your voice when you're ready. When you are ready before I enter the room. Okay, pillowing. Once I enter the room, I'll be placing a pillow under your ankle and stomach in order to take the pressure off your low back and to increase your comfort level. So this is only for the client is what? In the prone position, if you're supine, you will put the pillow under the knees. Okay. Dripping. Please note that during the massage treatment, the only area that will be uncovered is the area that I'm working on. Okay? The rest of your body will be dripped and under the sheets. Assure the client you're not gonna open them for no reason. Okay? Open the drip for no reason. Do you have any questions for me so far? Again, mention that. Frequency and reevaluate. Okay. For your condition, I would like to recommend you to come to see me twice a week for 4 weeks or once a week for 6 weeks. This is up to you guys. You can change. Okay. After the period, I will reevaluate your progress as well as reassess your condition. That's it. There's no more explaining ongoing treatment. Remedial exercise. I also get rid of the part that when I leave I come back from the room, the treatment is over, I'm going to talk about ongoing treatment. There's no more that part anymore. Okay? And home care, I will also show you some remedial exercise and self-care techniques that you can do it at home. These exercises include stretch strengthening techniques, which help you to further benefit from the treatment. Okay. So that's all that you can expect from the massage treatment. But lastly, I would like to discuss some additional information. Okay, this is the part that what? The consequences of not having the treatment. Okay, that you may choose not to have the treatment today. Okay, your condition may not improve or take longer to heal. In some cases, by doing nothing about your condition, it may cause it to become worse. Okay, you already tell them what can happen. Now, if you choose not to do, I don't like whatever you just said. Okay, and also this part that refer to another healthcare professional, which is as also if by the end of the treatment, your condition does not improve or you're not getting the result you were hoping for, okay, I would be more than happy to change the treatment plan or to refer you to another healthcare practitioner. Okay. That's the end part. Again, I'd like to remind you that at any time during the treatment, you may stop or modify the treatment. Do you understand? Do you have any questions so far? Make sure you give them the opportunity to ask questions. And then this part, may I have your consent to do this treatment? You must say the sentence. If you don't say the sentence, you don't get the marks on this room, because the purpose of the first 8 minutes is to wait for you to say this sentence. Okay? So if you forget anything, don't forget this one. Okay? So I'd like to remind you again that you may withdraw your consent anytime. If you have any questions, thank you. Let me wash my hands before I leave the room. That's it. Okay? If you don't have the new speech, come up to me, just then we'll ask for printout. Okay? So that's the room 5.